The importance of genetic awareness and screening. Welcome back to Techstination. I'm Fred Fishkin. Joining us from jscreen.org is CEO Dr. Matt Goldstein. Hi, Matt.
Hi, Fred. It's a pleasure to be here.
Great to meet you. Now, JScreen is a nonprofit, and your work with it is the result of a tragedy, really, that
Hmm.
affected your family. I'll let you go into the background for us.
Sure. My wife and I are both Ashkenazi Jews by background. We learned probably starting in Hebrew school that carrier screening for rare genetic diseases was something that we should do when thinking about starting a family. And as such, after we got married and started thinking about a family, both had carrier screening. My wife found out that she's a carrier for a disease called Tay-Sachs disease, and my report came back that I was not. So we got pregnant. She got pregnant technically, and gave birth to our first daughter, Javi. She was born on our wedding anniversary in 2018, 2 years to the day of our wedding, September 4th. She was beautiful, strong, and developed normally for about a year. At her 1 year appointment, we got a diagnosis of developmental delay. She had missed a few milestones. That sent us down a path of a diagnostic odyssey, physical therapy, occupational therapy, saw a bunch of different physicians to try and understand what was going on. Shortly after Thanksgiving, we got a devastating diagnosis that Hav had cerebral palsy. Unfortunately, it was devastating but wrong. And a few weeks later, we ended up in the office of a pediatric neurogeneticist at Boston Children's, and we got the truly life-shattering diagnosis that Javi had Tay-Sachs disease. My wife was 11 weeks pregnant with our second child at that time. So the next day we were in high-risk OB. My wife was getting a CVS, a chorionic villus sampling to test the fetus to see if the fetus was affected. We learned subsequently that the physician who had ordered my carrier test ordered the wrong test and misreported my carrier status. In order for a child to be affected with a disease like Tay-Sachs disease, they have to inherit one abnormal copy of the gene from each parent. And so we learned that my wife was a carrier and I also was a carrier. Our second child, our daughter Kaya, she's a carrier. She's not affected with the disease. She has my mutation. And she and Javi overlapped for 6 months. We lost Javi in January of 2021. She was about 2.5 years old, about 13 months after her diagnosis. And we have a third child, Ezra. We used IVF and a technology called PGT, which stands for pre-implantation genetic testing. So they use IVF to create an embryo and test the embryo for the presence of those mutations to see whether the embryo is affected. And Ezra doesn't carry either mutation, so Tay-Sachs is gone from his lineage, which is incredibly profound what our capability is today. And, this is the kind of thing that in today's medical system and society, given the tools and capabilities that we should have, this kind of thing should never happen. And unfortunately it did. And digging into how that mistake was made and why that mistake was made, it really exposed and sort of underscored for me what a tremendously exciting and powerful world we live in terms of these types of tools for preventive genetic screening. And it's not only for rare inherited diseases that can be passed on to a child, but it's for diseases like cancer, hereditary cancers. It's for diseases like hereditary cardiovascular disease. We have just incredible capabilities, and unfortunately, we don't use them in the way we could or should.
And your wife, Myra, wrote a memoir about the ordeal and created another nonprofit, I think, focused on those living with grief and loss. Congratulations to both of you for turning this tragedy into something positive. And when it comes to what you're doing with jscreen.org, Matt, step us through how this works.
So JScreen is an amazing organization that's been around for over a decade. And it really sits in between the labs that actually do the genetic testing. So commercial labs like Myriad Genetics, as an example, who have built incredible technology and capability to do this type of genetic testing. So they sit on one side. You have clinicians, hospitals, clinics that sit on the other side. Insurance companies that obviously pay for, or we hope pay for most of these services, and then patients. That's sort of the landscape of the space. And JScreen really sits in the middle of those entities and provides a super high quality, high touch service that begins at education. So educating patients, communities, families about what this screening can do, why you need it, when you need it, and then providing access to get that testing done in a very easy way, including an instantaneous or relatively instantaneous physician order for the test, and filling out the information that's required to get insurance reimbursement for the cost of that test for individuals who qualify. And then the testing kit comes to your house. You spit in a tube. It's a saliva sample that's used to run the sequencing test. So you can literally do it from the comfort of your couch. And then JScreen provides high touch support sort of to and through that process to ensure that individuals get the right test, do it at the right time, that the results are accurate, and that they know what to do with that information. And that includes genetic counseling done by telehealth, what we call telegenetics, in a really comprehensive way.
Why is that counseling piece of this so important?
I think the short answer is that genetics is complicated. We sequenced the human genome 25 years ago. It was an incredible effort, a tour de force. It took over a decade, cost over $1 billion. Today, we can sequence a human genome in basically a handful of hours for less than $1,000. What we have seen over the last 25 years in terms of the acceleration of technology and the capabilities that we have, and the knowledge that has gone along with that in terms of understanding the relationship between genetics and disease, it has just been exponential growth and an explosion of information, knowledge, and capability. Unfortunately, the medical system, and I think the healthcare system in general, is behind on really being able to use that capability and knowledge to its fullest capacity. And there's a whole variety of reasons why that's the case. But the development is sort of outpacing the healthcare system. Genetic counselors are one of a very small number of specialties that are really trained deeply in what that genetic information means, how to understand it, and how to action on it, what you do with that information. I think there's a common misconception that, well, if I go do genetic testing and I find out that I'm at risk for some disease, there's not anything I'm going to be able to do about that. I'm just going to sit with that knowledge for the rest of my life. That's not appealing to a lot of folks. The majority of the diseases that are on the panels that we offer through JScreen, those results are actionable. There are things you can do to mitigate, to prevent, to reduce risk for those diseases. And the genetic counselors play an absolutely critical role in helping to guide and support individuals and families through that information.
And once again, the types of screenings that are available, tell us about them. And if you have any comment also, I mean, we've all seen in the news about 23andMe and their bankruptcy, and maybe there's some confusion about that because people were getting reports, many people, from them.
Yeah, so JScreen right now offers two types of preventive genetic screens. One is called the reproductive carrier screen. That tests for over 250 conditions that could be passed from parents to a child. And ideally, that testing is done before an individual is pregnant. So when you're thinking about starting a family, and that can test for the risk of passing on diseases like cystic fibrosis or spinal muscular atrophy or muscular dystrophies, sickle cell disease, and obviously Tay-Sachs. The other test we offer is what is called the hereditary cancer screen. About 10% of all cancers are hereditary, meaning that there's a gene like BRCA, which is probably the most common and well-known, the breast cancer risk gene, that if you have a variant in that gene, it puts you at increased risk for developing a number of different types of cancers. In the case of BRCA, it's breast, ovarian, prostate, pancreatic, melanoma. It actually goes beyond just breast cancer. Those risk genes can be passed along from generation to generation and make up about 10% of cancers. And when you know that information, you can do a lot of things to prevent or identify one of those cancers early on, so that they're not showing up late stage when there's a much more challenging therapeutic environment. So those are the two types of tests we offer right now, and our hope is to expand and offer additional types of tests, including cardiovascular disease testing and others, as those become increasingly available and actionable. You asked a good question about 23andMe and the recent news around their bankruptcy and sort of what that means for JScreen and what that means for the field. I will say that I think what 23andMe did to normalize and familiarize the country and in some ways the world with genetics is something we owe them a tremendous debt of gratitude. They created a consumer product that made genetics cool and kind of fun and interesting, something that people could almost play with in a way. And that is tremendously important and valuable in making just the knowledge of this capability available. Importantly, 23andMe was not a clinical grade test from the beginning. They were more of a consumer-based test. You could use it to learn about your ancestry or whether you carried the gene for making cilantro taste like soap. And those are like cool, fun things. Ultimately, not a robust clinical grade test to inform risk of disease, which is what JScreen offers. Is the latter, is a robust clinical grade test with a set of genes that is actionable and can be used to inform and impact changes in the way we live our life and changes in the way we manage our health to mitigate or prevent the risk of that disease. So two sort of very different products in terms of what they offer, but ultimately, obviously, based on this sort of fundamental foundation of personalized genetics and the fact that those genetics are super unique to you as an individual.
Tell us more about the costs involved, and you touched on the insurance issue, and tell us about that too, because is it a struggle to get the insurance companies to pick up the costs here, or some of the costs?
Yeah, yeah. So I'll sort of give you an overview of what the cost structure is right now. So when individuals come to JScreen, they pay a program fee up front. That's $49. That $49 includes a physician order. We work with a third party physician ordering group that reviews the individual's records and history and actually places the order for the test. 39 of those $49 go to cover the cost of that physician order. It's probably not too far off from what you would pay for the parking lot at the physician, at the clinic or the hospital. So that's a relatively low cost. And then $10 of that $49 goes to JScreen to sort of cover the services we provide throughout the testing journey. And in many cases, the costs of the services we provide are subsidized by very generous donors and supporters. That program fee is the initial payment, and then individuals have a choice whether they pay cash for the cost of the test, what we call cash pay or self-pay, or use insurance. In many cases, individuals who meet appropriate criteria for either reproductive carrier screening or hereditary cancer screening will have the cover of the cost of the test covered by their insurance. In some cases, they may have high deductibles. In some cases, insurance companies may not cover the cost of the test. That is when we have financial aid and financial support available, both from JScreen as well as from the lab that we're partnered with who runs these tests, Myriad Genetics. And we also have the option of self-pay. So if people don't want to use insurance, they can pay $249 for the test. That is essentially sort of the maximum out of pocket that an individual will be responsible for, is ideally that $249. JScreen's mission is that we do not want there to be any barrier for any individual to access this testing if that is what they need and that is what they want. And that includes cost. And we have, as I said, very generous donors and supporters who make it possible for us to cover the cost of testing for individuals who need that. And the lab, Myriad Genetics, is also beautifully aligned on that mission as well. I'll just briefly touch on your question about insurance, which is whether insurance covers the cost of this testing, and maybe more generally, like the complexities of the insurance space and navigating some of this preventive health type healthcare that is not something that our healthcare system does a particularly great job around. What I will say is that for populations that are at high risk, whether that's because of an ethnic background or a family history, for reproductive carrier screening and hereditary cancer screening, many of the insurance companies will cover the cost of testing, and that's great. However, there are major insurers who, on a sort of blanket policy level, have elected not to cover this type of testing. And I think that is a real shame and really puts a lot of people and families at risk for things that we could fully avoid and in many cases prevent with this type of knowledge. I think that in many cases, insurers point to guidelines from organizations like the American College of OBGYNs, ACOG, or the American College of Medical Genetics, ACMG. Those guidelines are getting better and getting more robust, but they are relatively conservative at this point. And I think those organizations would do the population a great service if they expanded their guidelines and pushed those guidelines to be more aligned with what our capabilities are. But ultimately, I think unfortunately the insurance system doesn't do a great job of supporting preventive health type interventions, and that aligns with how our healthcare system is set up. We're not a healthcare system; we're a disease care system, and the way that we are trained, the way that the infrastructure is designed, the way that we interact with the system is not around preventive health measures, around things we can do to mitigate the risk of disease, but rather when we show up late stage cancer or end stage cardiovascular disease, we have incredible tools and capabilities that we can bring to bear on those types of situations. That's where so many of our dollars and so many of our interventions are going. And those things are important, but we've neglected, I think, our capability on the preventive side.
And that's why things are as expensive, I suppose, in some cases as they are, because the prevention, I guess, it can be a really smart economical decision, right?
Yeah, exactly. I mean, I think at the end of the day, uh, the cost of this type of testing is relatively inexpensive. You know, a couple $100 to do this, even $1,000 to sequence a genome, in comparison to a gene therapy for one of these rare diseases that costs $3 million for treatment, in comparison to the cost of treating an end-stage cancer with hospitalizations and ICU stays and therapeutics. There's no comparison there, obviously. And I think we have a long way to go to be able to get there.
Well, congratulations on the work that you are doing. Obviously, our hearts are with you and your family, what you've gone through. For more info, the place to go is jscreen.org. Dr. Matt Goldstein, thanks for taking time with us.
Brett, I really appreciate it. It's an honor to be with you, and I'm grateful for the opportunity to share a little bit about what we're doing.